Did a woman destroy her kidneys after taking a common vitamin? I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video, we're going to talk about vitamins in general and even go beyond what the AI bot is saying, which is an interesting thing to consider in this video. Where the information comes from. But be sure to listen to the end where I'll give you my final thoughts. So thank you for sending this video. It is from a website or YouTube channel called Healthy Nutrition. And it's hard to know what healthy nutrition is as the channel. When you look at the description of it, it talks about experts, but there's really no description of who the experts are. And so it's really kind of a murky source of information, which should kind of cause some hackles to go up. But let's see what they have to say.
Can a simple vitamin that thousands take daily be a silent killer? Imagine taking a supplement you thought was safe, only to end up in the emergency room with life-threatening kidney damage. That's exactly what happened to a 55-year-old woman whose story we're diving into today. Stay tuned as we find out what happened and how you can avoid making the same mistake. The case of 55-year-old. In December 2022, a 55-year-old woman suffering from kidney disease was rushed to the emergency department. She was extremely weak, had a very slow heart rate, noticeable swelling, and her body temperature was alarmingly low at just 93 degrees Fahrenheit. Concerned about a potential worsening of her kidney condition, doctors immediately checked her creatinine levels. The results were astonishing. Her serum creatinine levels had skyrocketed to 3,530 milligrams per DL, a number significantly higher than it had been just 2 months earlier. This indicated her kidneys were rapidly failing, she was no longer producing urine, and her body was overwhelmed with toxic substances. As a result, she was urgently moved to the intensive care unit and placed on dialysis that very day. The medical team was puzzled by the rapid decline in her kidney function. After extensive testing, they identified the unlikely culprit, a common vitamin supplement that many people take daily. It turned out that this seemingly harmless supplement was extremely harmful to her. It's not always the prescription medications that pose the greatest risk. Sometimes it's the over-the-counter vitamin supplements. Specifically, there are 5 vitamins that can be particularly hazardous if not used correctly.
Well, so it's interesting that it's, play by play, blow by blow, what happens to someone if you get admitted to the hospital. So it's a little overly dramatic. Turns out it's vitamin C that they're talking about, and it's not even talked about vitamin C until the 5 different vitamins are gone through. So it holds it's supposed to hold the suspense so that you go through all the other information. The main point so far, and I think it's a reasonable one, and that is if you have kidney trouble, if you have kidney disease, if you're in the medical world, you're in the clinic, you have health issues, you need to be careful about anything you take, including vitamins that might seemingly be healthy to normal folks, people who don't have medical issues. I just bring that up because sometimes you may not think through that you have a medical issue. Not so long ago, someone through my office came through, and the story was there was a vitamin C deficiency in this person on a carnivore diet. Well, the case unfolds, and I'm talking to this person, and it turns out this person had had weight loss surgery before and did not have normal anatomy inside. So if you're watching this and you've had weight loss surgery, you're not normal anymore. I mean, you have to be careful about the vitamins that you take. In fact, you probably should be taking vitamins. But so, if you haven't had any medical encounter in the last 5-10 years, which I've met people that way, then you may have some underlying trouble that you don't know about. So I'm still a fan of going to a doctor periodically and having blood tests checked, because you may not know you have some problem. You may feel well and blood pressure might be high, or there might be kidney trouble that you don't know of. But so far we have the context of someone who had pre-existing kidney trouble, and the doctors finally surmised that it was probably the vitamin C that caused it. Now, the video goes through 5 different other vitamins before we get to the vitamin C. So let's see what the other vitamins are.
These stories underscore the importance of being well informed about the supplements you use, understanding the appropriate dosages, and being aware of the risks involved. Kidney disease patients are particularly vulnerable because their impaired kidney function prevents them from effectively eliminating excess vitamins from their bodies. This can lead to a dangerous accumulation, putting their kidney health at further risk.
You know, the language, of course, is using the internet flowery, destroying the kidney function, things that you wouldn't see, your doctor wouldn't say that in that language. But the main point is a good one, which is if you have kidney dysfunction or kidney failure or renal insufficiency, these are all similar terms. It can be discovered by a simple blood test that's typically done at an annual physical, if you have annual physicals still. So I know that's kind of fallen out of favor in a lot of areas, but I still, as trained as an internist first, and then obesity medicine and keto medicine doctor second and third, I still think it's important to periodically have checks. The blood is an easy way to screen for lots of common things that you wouldn't know you even had. Of course, you don't want to make a decision or take action just based on something you'd want to consult with someone. For example, people get their blood tests frequently now on their own without a doctor's order, which can be done in most states. And if you get upset or worried about something out of the normal range, you want to be sure to talk to someone who understands what the normal range is when you don't eat a typical American diet. So in most cases, the blood levels of vitamins do correlate well, but not always, with the clinical symptoms of problems. So let's get back to these vitamins. And if you've listened to my channel, I'm not a big promoter of vitamins. I think if you get the food right, you can get the vitamins that you need in the food. And if you have normal absorptive capacity, you haven't had weight loss surgery, for example, and if you're eating a great diet. So of course, food is medicine if it's good food. And so now let's go through these different vitamins.
Vitamin number 5. We'll start with the least dangerous and move to those with increasingly severe risk. Coming in at number 5 is vitamin D, a vital nutrient for kidney health, which might sound familiar as I've emphasized its importance repeatedly. However, it's essential to manage your intake carefully. Vitamin D is fat soluble, meaning excessive amounts can accumulate in the body, potentially leading to complications such as hyperphosphatemia and hypercalcemia. Both conditions are serious and can cause arterial calcification. In some cases, high levels of vitamin D can even lead to acute kidney injury. To avoid these risks, it's recommended to consume vitamin D in moderation. The ideal dosage is typically about 2,000 IU per day, combined with 100 milligrams of vitamin K2 and magnesium to prevent arterial calcification. This regimen helps maintain vitamin D levels safely.
Now, I'm just going to say I don't recommend vitamin D, vitamin K, magnesium. It really hasn't been sufficiently studied to my level of evidence that I need in order to sign off on something, and I know there are other people who have lower levels of evidence. They don't require things in their minds to be tested. But here we see there are risks of having too much of these vitamins, and in my video that I did on vitamin D, I know it was a little bit controversial because I didn't recommend it. Vitamin D levels actually go up as you lose weight, so I don't give vitamin D even if the vitamin D level is low if you're going to be losing weight on the kind of program that I teach. But even videos about vitamin D, they caution about having too much, and that's what hypervitaminosis means, too much D. So a lot of people think they have to supplement. I'm not there yet. I need better evidence even to supplement with vitamin D. Even here, the language, again, is still a little fear-mongering, and I think the main point is that if you have kidney trouble, yeah, you want to be careful. Even if you're otherwise healthy and you're eating great foods, I don't know that there's a need to supplement and to take on the risk of having too much.
Vitamin number four. Number four on our list of concerns is cyanocobalamin, the synthetic form of vitamin B12. Unlike its natural counterpart, methylcobalamin, cyanocobalamin is not derived from natural sources, but is manufactured for its cost effectiveness. The cyanocobalamin is known to contain trace amounts of cyanide, a fact implied by its name. While the body of a healthy individual can process and eliminate these traces of cyanide without any issues, the situation changes when kidney function is compromised. While it's vital for those on a renal diet to supplement vitamin B12 to avoid deficiency, which could trigger a host of severe health issues like vascular disease and anemia, choosing the right form and dosage is equally important. Habitual deficiency of vitamin B12 can lead to significant health complications, so supplementation is necessary, but it must be approached with caution. To ensure safety, it's advised that individuals, especially those with CKD, check their supplement labels meticulously to confirm they are consuming methylcobalamin and not cyanocobalamin. By doing so, they avoid the risks associated with cyanide while still reaping the benefits of vitamin B12, which is essential for maintaining good health.
Well, so vitamin B12 is found in the food, in good food, in animal products, and I'm not sure everyone needs supplementation, but again, the main focus of this video is that if you have kidney trouble, you want to be sure what type of vitamins that you're taking. And I think that's a good point. Be sure to talk to your doctors, the kidney failure specialists, nephrologists, especially if you're on dialysis, you'll see them frequently. And you can just take your vitamins in and get it looked at by your doctor to make sure that they're happy with it. I'm still not sure about the nuance and especially the fear mongering about the worry here, whether it's how big a worry it needs to be. Vitamin B12, of course, is something, vitamin of vulnerability if you do a vegan diet, if you don't have any animal products and you have to supplement there. But I don't think you need to if you're eating animal products. The idea of with reduced kidney function, again, should be checked out with your nephrologist.
Continuing with our countdown, our third entry highlights a widely used vitamin that may pose significant health risks. Studies have linked this everyday vitamin to a range of adverse effects, including markedly increased blood pressure and an elevated risk for stroke and cancer. While natural vitamin E has its advantages, the synthetic variant alpha-tocopherol carries significant risks and should be avoided. Be especially cautious with any supplements containing high doses of this synthetic ingredient. Always consult with a healthcare professional before adding any form of vitamin E to your regimen, particularly if you have underlying health conditions like kidney disease.
Well, so that last line has been repeated over and over and over, that if you have medical problems and kidney trouble, be sure to talk to your doctor about all of these vitamins. And it really is interesting to hear this go on and on and on. The main message is that if you have kidney trouble, be careful with vitamin supplementation. And I guess what I wanted to editorialize here is that you don't have to do any of this supplementation if you have normal absorption and you're eating a healthy diet. I'm still not convinced adding any of these to a healthy diet is going to be incrementally beneficial until the studies are done in the context of a very healthy type of diet, the kind of low carb, protein, adequate fat based sort of dietary program. You get all of the vitamins that you need.
Number one, and now taking the number one spot on our list is vitamin C. Let's dive deeper into the severe case of the 55-year-old woman who experienced catastrophic kidney damage, shedding light on a critical health issue related to a commonly consumed supplement. The central focus of her health debacle was none other than vitamin C, a supplement that many might not suspect due to its widespread use and essential health benefits. Among her daily routine were multiple supplements, calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and notably vitamin C. Each of these played a role in her overall health strategy, but only one contributed to her swift and severe health decline. Medical professionals were initially puzzled by the rapid deterioration of her kidney function. The breakthrough came when a detailed kidney biopsy was performed, revealing extensive accumulation of oxalate crystals. This condition is uniquely linked to excessive intake of vitamin C. The daily intake of 1,000 milligrams of ascorbic acid, commonly recommended as a normal dose for boosting immunity and combating vitamin deficiency, proved to be a disastrous oversight for her weakened kidney condition. Typically, vitamin C is celebrated for its antioxidant properties, boosting the immune system and even enhancing iron absorption. However, in her case, the high dosage turned harmful, with her body unable to process and eliminate the excess effectively. This incident underscores a broader health lesson: the necessity of moderating vitamin intake, especially in individuals with pre-existing health conditions or compromised organ functions. The oxalate crystals formed from the breakdown of too much vitamin C can lead to kidney stones in healthier individuals, but for those already suffering from kidney issues, the consequences can escalate to kidney failure, as seen in this unfortunate case. Furthermore, this story highlights the importance of medical oversight when taking supplements, particularly for those with chronic illnesses. Patients with kidney disease or other significant health issues should consult healthcare providers before starting or continuing any supplement regimen to tailor their intake based on their body's specific needs and limitations.
Well, we've heard that now 10 times. If you have medical problems, especially kidney disease, be sure you consult your doctor about adding vitamins. Now, vitamin C is fascinating because there was an era where high-dose vitamin C was promoted, and still a lot of people take it, or maybe just during times of colds, that sort of thing. What is interesting is that whenever you have anecdotes or stories about a kidney stone with someone taking vitamin C, it's hard to know the percent or how likely, how common it is. Even when you consume information on the internet and you hear someone had some event, you don't know how many people didn't have the event. And you can have a case study or a case report of something, and then it causes alarm, but was there a second case, or was there a third case? So I think the main point in this video is that if you have abnormal kidney function, and if you don't know if you have abnormal kidney function, you can figure that out by a simple blood test by your doctor, then you want to be careful about adding vitamins. I think that the more general idea is be careful about adding vitamins anyway, and you want to get the food right so that you don't have to take extra vitamins. I'm actually kind of shocked sometimes with a dozen pills, vitamins that are brought in by people who are trained and accustomed by sellers of vitamins online or stores to make you think you have to have these because the food is in some way deficient. I need a higher level of evidence to prove that the food is deficient. If you get the food right, I think you'll get all the vitamins and minerals that you need, as long as you have intact intestines. If you have had weight loss surgery, you may have to supplement with the bariatric vitamins, especially designed for those who've had weight loss or bariatric surgery. The main point in this video, I think, and point well taken, is you want to be careful about anything you consume, and the right dose may depend on who you are, your genetics, your underlying medical conditions as well. But hey, why not start with real food and get most of the nutrition, including the vitamins and minerals that we need from the real food? I know it's a radical concept. I hope you like this video. If you like it, please like, subscribe, and ring the notification bell. I'm putting out new information on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.